emergency response team that went down to Marathon, Florida and to Tallahassee, Florida to help with the response to Hurricane Irma that affected Florida. They're returning today. They worked in Tallahassee in the State Emergency Operations Center, working with public health and the public health response there and helping coordinate all the activities that were going related to helping hospitals and healthcare and boil water and all the normal things that we do in disaster response in Mississippi, doing that same thing in Florida. After they started that mission, they also traveled down to Marathon, Florida, where a hospital was impacted in Marathon, Florida, took on water, and they're trying to build another facility, a temporary facility. Fortunately, it was the same facility that we brought to Louisville, Mississippi after a tornado in 2014. So we had some expertise there, and they were able to get this unit set up and ready for occupancy before they left. So they're coming back today, and what you see in some of the other footage is them going through the demobilization process so they can go back home and get all their receipts processed and their travel processed and all the things necessary for them to close out this mission and return back to their normal functions.
When we arrived in Tallahassee, the leadership for ESF-8 had been at work for about 4 days nonstop. So we started integrating into their leadership staff positions, and so they could rotate their staff out, and worked a week doing that. When we first got there, they were tired. They were what you would expect after working nonstop for days on a response. And they were very happy that we were there to help relieve them and pick up some of the slack, help them get back on track with some of their incident command functions, preparing plans for the incident command, and working in the EOC with other ESFs in the Florida Emergency Management Agency. We shifted gears when we changed missions and went to Marathon, Florida. It's devastating. The hurricane tore most of that island up, and then just below that, Big Pine Key and a couple of the smaller keys are just devastating. The people that were there, the residents, were in need of medical care. There was a DMAT team that was taking care of them, but lots of them came to us looking for treatment. So as we were working at the hospital, we had to get them to the DMAT team for treatment. The DMAT team demobilized the same day that the hospital went online. The people that we worked with at Fisherman's Hospital, which is part of the Baptist Health System of South Florida, were just great to work with. They were very appreciative of the asset that was brought in to help augment the hospital itself was damaged. It's old, needs renovation, and will probably be out of service for close to a year. So this was an opportunity for them to be able to stay in the community, keep their staff working, and treat the people of Marathon.
Just got down there and went to work, and that's sort of what we do whenever a disaster strikes, is we get to work. And and so we got to do that, and the people of Florida were very appreciative of it and enjoyed everything that we did. They were very nice to us, make sure to take care of us while we were there. Instead of worrying about their own selves, they worried about whether we was getting too hot, whether we was staying hydrated enough. And so, it was just great people down there, and it was a great experience to have. I hate that there was destruction, but there's always going to be destruction somewhere, and I was just glad that Mississippi was able to step up and help the people of Florida out and allowed me to go down there and be part of that.
I visited with the Secretary of Staff down in Florida this morning, and they had some great comments about our team while they were down there working and how much they appreciated all of what they did for them. We're very, very proud and very, very happy of this team. During Katrina, the worst disaster we've ever had in the state of Mississippi, we had states that came to our aid, and Florida was one of them that came in a big way and helped us. So we're very hopeful that part of what we were able to do to go help Florida in this mission helps pay part of that back, because it is a team sport. It takes all of us to work disasters, and we have to help each other.